Well, so talking about consultations, that maybe gives me a segue into my next question, which is, can you explain to us, like in layman's terms, what is it that you actually check for when you perform a comprehensive eye test? When somebody walks into your practice and says, "Hey, I'd like to have a consultation with you." How long is your typical consultation, and like what happens during that time? Like, what are some of the examinations and tests and things that you look for?
So, in terms of how long does a standard consultation take with us, it is anywhere from 30 minutes to 60 minutes. So, there are certain types of consultations that we allocate a longer time for, and they might be a diabetic consultation or a new patient or a person with complex needs, in which case we automatically will book a longer consult of a 60-minute consult. Um, but the standard consultation is 30 minutes. And that certainly used to be standard in the profession. And I think 20-minute consultations are becoming much more prevalent, much more common at a variety of practices. But I don't think you can do enough in 20 minutes, in
Mm.
my view, to provide enough care. One of the biggest things, that's the first thing that we do when we enter the consulting room with a patient, is say, why are you here today? Is this a routine checkup, or is there something in particular you want me to look at? Because that will change my whole persona and my whole attack of what I do. If someone's coming in with a specific complaint, then that's the thing that we'll concentrate on. And at the end of that, if we've got to the resolution and we've got an answer to what their particular complaint is, or we've got a diagnosis, then we'll be saying, look, I want you to come back, and we haven't done our regular full consultation, but I'll get you to come back for that. If someone's coming in for a regular consultation, then part of that is case history, which is literally talking to each other. So me asking a patient question, saying, do you have any troubles with your long distance vision? Do you have any trouble with your near vision? Do you have trouble on the computer? Are any of those things that you wear glasses for or contact lenses for? Do your eyes feel dry or itchy at the start of the day or at the end of the day? Are there any sort of symptoms where your eyes feel funny or you're light sensitive? And all of those sort of questions and answers with patients takes a bit of time. It's almost like I'm getting to know my patient
Mm.
and they're getting to know that I'm actually interested in what their answers are.
Mm.
Because each one of those answers is I'm categorizing in my brain about when I start doing my exam. I say, I might look at them using a microscope called a slit lamp, and we look at the front surface of the eye. And I say, well, look, you mentioned before that you've got some trouble with glare sensitivity and headlights at night really bother you. What I can see when I look in your eyes is some cataract. And cataract is a cloudiness that causes scatter of light. So any light that enters your eye gets scattered and dispersed. And what we see as a patient when we've got cataracts and lights entering our eyes is glare,
Mm.
starring, starburst, halos, and all that sort of stuff. Do you see things like halos and starbursts on headlights at night? Do you see them in the daytime? And that opens that dialogue again, and it shows the patient that I've listened to what they had to say before. That they're important, that their symptoms or their complaints are important, and we try and find an answer for those in the checker. Beyond that, we also look at the pressure of the eye. So we've got a couple of different types of machines to check the pressure. I've got my favourite one, which is a little handheld tool called an Eyecare, and an Eyecare doesn't require any anaesthetic or any sort of dyes or drops going into the eyes. So it's almost a tickly sensation having the pressure done. It's a bit better than the puff of air testers of years gone by. We also check the back of the eye, and the back of the eye can be checked in lots of different ways. So we can do it manually using that same microscope that I talked about before. So we can hold a little lens up to the eye, and we can actually see right the way into the macula and the optic nerve, and look to see if they're flat, look to see what the blood vessels are like. Beyond that, we can actually take images, what they call retinal or fundus photos. And there are traditional fundus cameras that work great, and they give us high-res images. And there are new generation sort of confocal scanners, and I've got one of those in my consulting room. And the iodine confocal scanner is quite amazing. So it's an ultra-wide field capture device, so it captures a wider field of view than a normal camera would, with high resolution and high definition. And in the same time it takes a normal camera to take a single photo, iodine captures 1,000 images. And from that, it gets a composite image that is what we get to see, and that's what we put up on the screen, and we have a chat with our patients. Both Adam and myself that work at Martin's Eyecare, we both like doing that. We like educating patients, so we'll get it up on the screen and say, "Here's your macula," and there's perfectly, that's exactly how a macula should look. Or here's your macula, and there's some aging changes there. There's some age-related macular degeneration changes. We look at the optic nerve, we look at the blood vessels, and each one of those we say this is great, or it's not, or it's got some problems, or we point out a problem. And then say, have you got any questions about that? Always we sort of come back to, does the patient understand the things that we've tried to say? And we don't use as much Latin, a lot of medicines in Latin, because most people don't speak much Latin. So we
Funny
try
that.
and use everyday terms, and I often tend to use analogies. So, if I'm talking about the shape of an eyeball could be perfectly round like a soccer ball, or an eyeball could be shaped a bit like the side of an AFL football. And most people in Tassie get the difference between the two, and it's a tangible thing that people can understand. And I also use props in my room. I've got little models that I use and I pull out all the time to sort of demonstrate or show what their cataracts look like in reality, or what their eye shape is like if I've got a little squish toy of an eyeball. So, and I think that's good. So at the end of the day, we want the person to understand it. Maybe not in the depth that I understand it, but I want them to understand exactly what's going on in their body, in their eye. And then if they're better educated and better informed, then they'll make better decisions about their eye health going forward.
Wonderful. Okay. Well,